group project of the first assignment about infertility. Let's get to know with us. Here are our group members. What does actually infertility is? So, based on some articles, infertility could be defined as the failure to achieve pregnancy after 12 months of regular unprotected sexual intercourse. And based on some research that has been conducted, it is said that approximately 85% of infertile couples have an identifiable cause. And the most common causes of infertility are ovulatory dysfunction, male factor infertility, and tubal disease. There are actually many cases of infertility, including Malaysia. In Malaysia, the recent statistic released by the OSM for 2021 had shown a decrease in live births by 6.7% compared to the year 2020, and this is the highest decrease seen in a decade. Total fertility rate, which is an indicator used to estimate the average number of children that a woman would have over her childbearing age, had shown a significant decline over the last 5 decades, with 4.9 children per woman in 1970 to 1.7 in 2021. The data of fertility in Malaysia has been presented in graph, and this shows how the data of fertility has gradually decreases over time. The current population fertility rate of Malaysia is 1.5301 births per woman. Thus, this shows that negative 0.84% has decreased from 2024, when the fertility rate was actually 1.543 births per woman. And the reduction in fertility and live births in Malaysia will give huge impact on the nation, either on socially, economically, and financially itself.
Is there any medical help for infertility? The answer is yes. Absolutely, we have IVF treatment. So, what is IVF? IVF, or in vitro fertilization, is a form of assisted reproductive technology. It involves combining an egg and sperm outside of the body in a laboratory dish to create an embryo. This embryo is then be transferred into the uterus to support a potential pregnancy. IVF is commonly used when couples face infertility or are unable to conceive through other methods. The term in vitro literally means in glass, indicating that the fertilization happens outside of the body in a controlled lab setting. The primary goal of IVF is to help individuals and couples to achieve pregnancy when natural conception is not possible. It addresses challenges like blocked fallopian tube, poor sperm quality, ovulation problems, and conditions like endometriosis or PCOS. IVF can also include genetic screening and fertility preservation through freezing eggs, sperm, or embryos. There are several factors influence the success of IVF. Age is crucial. Women under 35 typically have higher success rates, while success tends to decline after 40. Embryo quality, reproductive history, and lifestyle choices like smoking, alcohol consumption, stress, and obesity also significantly impact outcomes. Overall, genetically healthy embryos have a 60 to 65% success rate when it comes to live birth. What is the step involved in IVF treatment? IVF treatment involves a series of careful planned steps. It begins with an initial consultation to assess the patient's fertility status. Next is ovarian stimulation, where medications are used to encourage the ovaries to produce multiple eggs. The process is monitored regularly through scans and tests. Once the eggs are matured, they are retrieved and sperm is collected from the male partner. Fertilization then takes place in the lab. The resulting embryos are monitored as they develop. One or more embryos are then transferred into the uterus. After the transfer, luteal phase support is provided with hormones to help implantation to happen. Finally, a pregnancy test is conducted to confirm if the procedure was successful. This video will show how IVF works. The first step is taking fertility medication in the form of shots to help your ovaries produce several mature eggs. The goal is to make 10 to 15 eggs. It takes about 2 weeks until your eggs are ready for retrieval. The retrieval process is a 15 to 30 minute procedure. The doctor uses an ultrasound to put a thin hollow tube through your vagina and into the ovary that holds your eggs. The needle is connected to a suction device that gently pulls the eggs out of each follicle. Now comes the part everyone most familiar with, combining sperm with your best eggs. In IVF, the egg and many sperm are left in a laboratory dish to fertilize on their own. The fertilized egg then divides itself until it reaches the blastocyst stage 5 to 6 days after fertilization. Multiple embryos are then transferred back into your uterus in the hope that at least one will implant itself and begin to develop. This video will show how IVF works. The first step is taking fertility fatwa on IVF. In the 5th and 6th Muzakara of the Fatwa Committee of the National Council for Islamic Religious Affairs Malaysia has discussed the issues of test tube babies, which refers to children conceived through IVF. From these discussions, several important decisions were made. First, a test tube baby is considered valid in Islam if the semen and ovum come from a legally married husband and wife and the fertilization is done in a respectable manner. However, if the sperm or egg is taken from someone other than the husband or wife, then it is not valid in Islam. Second, it is permissible for babies born through medical intervention to have the same right as any other child, including the right to inheritance from their parents and family members. Third, as long as the IVF process between a husband and wife is done without contradicting Islamic teachings, it is considered a respectable and acceptable means. However, one situation has been clearly prohibited. The use of a husband's semen stored in a sperm bank after his death by the wife for the purpose of conceiving is not allowed in Islamic. In conclusion, Islam permits IVF under specific conditions, especially when it respects the sanctity of marriage and adheres to Islamic values.
To sum this up, infertility might be seen as a weakness for married couple and somehow affect the country itself. Therefore, many ways have been produced in order to overcome this issue, like IVF and IUI, and many patients successfully produce their own offspring. Hence, this has proven the effectiveness of the treatment. Therefore, couples should strive their best and try as many ways as possible to avoid infertility issues in Malaysia from increasing.